It's about thinking, treatment is sometimes something you do rather than something you take.
Hi, and welcome to That Cancer Conversation, the podcast that brings together the science and the stories behind cancer. I'm Sophie from Cancer Research UK. In this episode, we're talking all about exercise. We know that exercise is great for our well-being and can reduce our risk of disease. But can exercise help us with recovery? And could it help us move forward from cancer? I'm joined by Cara, a former professional netball player who was diagnosed with bowel cancer back in 2022. But after her cancer treatment, she's now a personal trainer specialising in cancer rehabilitation. Cara, welcome to the podcast.
Thank you for having me.
Thank you for joining me. What was it like being a professional netball player?
It was an interesting experience. So I played a version of netball called Nets. It is slightly nuanced in terms of the rules from traditional netball. We play in high tension nets. The ball never goes off court. And there are some variations in the rules. So you can take 2 pointers. It's really fast paced, really energetic, really exciting. I really enjoyed it. I went on 3 world tours.
Wow.
Twice in South Africa, 1 in Australia. Loved playing with the team. Really great for fitness. And I love team sports. So you make long-lasting friends doing team sports.
So what was it like when you got your bowel cancer diagnosis? How did that change things for you, especially when it came to like your body and like playing sport?
It was tough. I got the formal confirmation a day before my birthday. It was very surreal. I had 2 weeks prior played in a Premier League match. Albeit I remember leaving that match feeling extremely exhausted, extremely tired. I was diagnosed. I went through a grueling 1.5 years of treatment. The day I was diagnosed, I signed up to a local boxing gym down the street, and I signed up. And my first course of treatment was radiotherapy, and I managed to do those classes during radiotherapy. And I remember signing up for the next bout of sessions, and I prepaid. That's the level of confidence I had. And my next treatment plan was supposed to be surgery, but my margins weren't clear, so they decided to give me my chemo ahead of surgery. So I had 3 months preoperative chemotherapy, and I remember after my first round, I thought once this clears, I'll be able to go back, and I wasn't. Chemotherapy really hit me, the fatigue, low levels of energy. And I had to adapt, and I had to learn how to adapt, and I had to also accept that that's okay. But I still managed during my treatment to attend netball training sessions when I could. I'd normally just about manage a warm-up, so I'd run around with the girls, do a bit of stretching, and that's the max I could do. My treatment progressively took its toll on my body.
Was it like quite strange to like see your body in that way?
I think visually. So I've always been a slim person, and I've always been quite toned, but I remember looking in the mirror one time after my diagnosis. So preceding my diagnosis, I spent probably 2 to 3 weeks in bed, not being able to eat, with just severe gastrointestinal issues that at the time we couldn't pinpoint what that was. In the first week, I'd lost about a stone. And I remember the first time I was able to get out of bed and walk, and I looked at myself in the mirror, and I couldn't believe how much muscle mass and tone I'd lost. So visually, it was hard to combat that. And I remember just wanting to get up and not letting it define me, and just wanting to maintain a degree of normalcy as possible, right? So, but my body had other plans.
And like you were saying, you wanted to keep some normality, like of your routine and like your ability and just engaging in sport, because you said it brings you so much joy. How much of that was like mindset, and then how much did you feel the benefit from actually doing that, not just mentally but maybe physically as well?
Yeah, I had feedback actually on that from my medical team. And I remember one of the nurses, when I went into the hospital that I was treated at, and she saw me in the foyer, and she said, "Oh, Cara, how you doing? You've been so under the radar. I haven't heard anything about you in terms of how you're coping in terms of your treatment." And she said, "Keep doing what you're doing. It must be all this exercise that you're doing." And she said that, and I tried to make sure I did a form of exercise daily. Mentally, that was a struggle when your body physically is saying, "I just want to rest." And when I say exercise, I don't mean I'm not out here lifting heavy deadlifts or trying to do HIIT classes. I'm talking like walk down to the end of the road and back, right? Get out, do some exercise. So really helped me, I guess, physically, because my medical team saw that, but also mentally, not having to stay in the house 24/7, helping to release those endorphins that we all know that exercise does give. And on the occasions where I was able to go to training sessions with my netball team, that social aspect really helped me get through a really, really tricky, difficult period.
Like having such a physical setback in what you were able to do, did it compromise that identity of being an athlete? Or was that always being like, I know my body can do this. It can't right now, but it will.
Yeah, I think it did. It did compromise my identity, which I did have a think about this, because I was like, I don't particularly athlete or being an athlete or being a fit person, I don't want that to be my whole identity, but it was a significant part of it. So it did impact me, but I had to disassociate myself with that. Whilst that was still a part of my identity and still is now, I did have to disassociate myself with that. So yes, I lost that identity, but also I realised that, yeah, I'm also like, I'm an amazing friend, and I've got amazing friends, daughter, sister, and other things.
You also took part in a Cancer Research UK Race for Life. How did that come about?
I honestly also don't know how I did it, to be honest, because I did it mid-treatment. That was my second time I did Cancer Race for Life. So the first time I had done it was, I'd like to say maybe 3-4 years prior to my diagnosis. I ran for my auntie. She'd recently passed away from skin cancer. And I thought, yeah, let me run it. And I've never been an avid runner. I don't really enjoy long distance running. It's ironic that I ran that Cancer Research race the first time. Probably I had an early stage tumour at that point, not knowing. And so I don't know what prompted me to do it. I'd finished radiotherapy, or I was in the middle of radiotherapy, and I said to my mum, I want to do a race for life. Let's do a race for life. So me and my mum would run like once a week. I think the max I got to was about 2 or 3K. And I don't know how I'm going to run this 5K on the weekend, because I can barely muster 2K. And I mentioned it to my netball club. I said, "Oh, I'm just running this 5K," and they were like, "Okay, that's great. That's amazing. We'd love to support you." Right. So on the day, there must have been about 15 of us, including my mum, and my friends. So my netball club and my friends, some of them brought their children. And I remember standing in line. I said, "Yeah, I'm gonna run, but I probably won't be able to run the full pace, because I had radiotherapy, although treatment hit me as hard as some of my subsequent treatments. It did fatigue me quite a lot. Adrenaline's an amazing thing, and I ran the whole way. And when we got to the end stretch, it might have been 100 meters or so, I picked up a sprint. So I started sprinting down the end, the last kind of few meters. So then I heard my name, and she said, "It's Cara, she's running, and she's currently going through cancer treatment." And then everyone else was cheering. So not only my friends that I was running with, crowd that I didn't know, and it just spurred me to sprint to the end of the finish line. And it was one of the amazing things. And I did it because I really admired the work that Cancer Research had done, the treatment that I was receiving based on the research that someone else had done and paved the way. And so I wanted to give back, and I wanted to do something, again, tied to exercise, of course, but not necessarily exercise that I really enjoy, but tied to exercise and an environment that just wasn't high pressure. And I was exceptionally proud. I think we ended up raising amongst all of us close to £1,000 for cancer research. So yeah, that was great, and it's a real poignant moment that I think about, because I look at the pictures, and you would not have been able to tell that I was going through cancer treatment at the point, with a severe tumour still present inside my body. So yeah, I would say adrenaline. The mind and the body can do a lot more than you think you're capable of.
Yeah. I mean, is that something that really stayed with you and maybe encouraged you to want to do this cancer rehabilitation level 4 course and kind of give that sort of understanding to others as well?
Yeah, I think that, coupled with the real drive, was, I remember sitting in my house. It was this booklet I had. I remember reading through the booklet. Really, really simple exercise that everyone would know, like kind of dead bug kind of exercises, and knee to floor plank, so not putting enough strain on your plank. And I remember how challenging I found that when I first started. And then I remember progressing from that, and I remember feeling a lot better when I could do the exercises a lot easier. And then I remember thinking, what now? Honestly, I remember sitting there thinking, well, what do I do now? How do I bridge this gap from where I am to getting back to where I want to be, or at least being able to go to the gym and lift some weights? I had no idea. And I remember Googling, and I didn't know enough, or I didn't even know who to turn to and talk to. There's loads of PTs out there. There's loads of trainers. My friend had recently qualified as a personal trainer, so she helped guide me back to fitness. But I didn't know anyone that had been through a cancer diagnosis that could help me understand not only the risks but also the benefits. And so it was that moment that prompted me. One, it was, again, came from quite a selfish perspective, that I just wanted to learn more. And then the second, as I started to learn more, I think, well, I can't have been the only one that was going through this and struggling. So there must be more people out there. So why not try and help those individuals?
Mm. And what did you find? I mean, you said that it was a long process, like studying for it, and like a lot of biology, a lot of oncology to study.
Yeah.
Was there anything that really surprised you, or maybe like you kind of knew about exercise and cancer, but then like it kind of got solidified, or you kind of realized that there was science behind maybe some of the things you'd experienced?
I guess the point of the science behind, I didn't, and I hadn't. There was lots of references in the coursework that I was provided, lots of research documents, and I just didn't know that there was so much research documented about cancer and exercise. A lot of what I knew prior to that course was hearsay. You know exercise is good. Obviously, it's going to be good to help recovery. I just didn't know scientifically how much research had gone into it, to the extent that there's something called exercise prescription. So you can go to a medical professional, and they can prescribe you exercise as a treatment plan. I did not know that. It was news to me. So I found learning really interesting. There's lots of things I resonated with. My goal was always to give back to charitable organisations and just offer my services to help others who were going through something similar, and so that they don't have to go and find or search the internet and find solutions independently. They can rely on individuals who not only have a lived experience but have now qualified in that subject, just to help guide them, knowing the mental and physical benefits that exercise can have.
Cara, thank you so much for being on the podcast and sharing your story and your expertise with us.
Thanks so much for having me.
Exercise can make a huge difference to recovery and well-being, just like it did for Cara. But could it go even further? Could it actually help us survive cancer? To help answer this question, I'm speaking to Professor Vicky Coyle, a researcher at Queen's University Belfast, who led the UK arm of a groundbreaking international trial that investigated whether exercise could help people survive bowel cancer. Vicky, welcome to the podcast. Thank you so much for being here. I mean, you're a practicing oncologist as well as a researcher, and we can see you're in your practice right now. Thank you for making the time to come on the podcast. How did you get interested in studying cancer and exercise?
So I'm an oncologist with a focus on bowel cancer, treatment of bowel cancer. And while treatment has improved and outcomes have improved for our patients, there's still more to be done, both to improve cancer outcomes for our patients, but also to improve their overall health, their physical health, their mental health, and their quality of life. And we also have a growing proportion of patients who are living with and beyond cancer, and we want to make meaningful differences to the lives they lead. So exercise has many, many health benefits, and there's some really intriguing data from population studies and observational studies that it might improve cancer outcomes in patients who've had a diagnosis of cancer. And so that was really what sparked my interest in this area.
Amazing. So what did we know about exercise and cancer before you did this trial?
So for many years, there's been fairly compelling data that exercise can reduce the risk of developing cancer. So observational studies that have looked at the most versus the least physically active patients suggested a lower cancer risk in the most physically active patients. There was also observational data that suggested that patients who were physically active after a diagnosis of bowel cancer had a potentially reduced risk of cancer recurrence. And this was really intriguing. But I suppose the kind of criticism potentially from the oncology community was always, well, these are observational studies. You don't know whether there's something special about that group of patients. You know, is that enough to change care pathways or change treatment pathways?
And is that kind of what led this trial, which is called the Challenge trial? Could you tell me a bit about it and what you were investigating?
Yes, the Challenge trial or the Colon Health and Lifelong Exercise Change trial was looking at the impact of physical activity on survival following a diagnosis of bowel cancer. And it was developed and led by the Canadian Cancer Trials Group. And it was really off the back of this really strong observational data suggesting that post-diagnosis physical activity levels could be important in reducing the risk of cancer coming back. So it was designed to test this question and provide us with an answer as to whether exercise did help improve outcomes. And in the Challenge trial, we included patients who had had their routine surgery and chemotherapy for high-risk stage 2 or stage 3 colon cancer. And they were randomized to usual care, which was really providing them some general health information about healthy living, or to the exercise intervention, which was a structured exercise program designed to bring their exercise levels up to a tailored degree, individualized for that patient over the 3 years following their end of treatment and enrollment in the trial.
And what kind of results did you see within that trial?
Well, the trial was positive for its primary endpoint, and that was to look at the impact of exercise on recurrent or new cancers. And there was a 28% reduction in the risk of recurrent or new cancers. And when we actually look at overall survival, when we look at the patients who were alive at 8 years of follow-up, there was a 7% difference in the survival rates between the control group and the exercise group. And when we think about that kind of size of benefit, 7% overall survival gain, I mean, that's at least as good as many of the treatments that we use.
Wow, that's a huge difference. I mean, is the type of exercise important to achieve this result?
Yeah, so all exercise is good. And I think, you know, the most important message for the general population, as well as our patients living with and beyond cancer, that being active is better than being sedentary. There are different types of exercise: aerobic or cardiovascular exercise, resistance training, balance training, things like meditation, mindfulness, yoga. So they all have their place in terms of improving health outcomes and reducing symptoms or problems related to cancer. But in the Challenge trial, we were very much focused on aerobic or cardiovascular exercise, and it needed to be moderate or vigorous intensity. So that might sound scary to people, but actually it's not. So we were encouraging patients, there's different ways you can measure moderate intensity exercise, But actually the easiest way is saying, imagine you're walking to an appointment. It's a really important appointment and you're running late. So you're walking briskly, you're feeling warm, you're still able to kind of talk to somebody, but you feel like you're working. And we use something called the rate of perceived exertion to try and kind of put that on a scale for patients. Or for those who wanted, they could also look at doing like heart rate training, which is easy these days with modern technology. But actually it's the kind of things for moderate intensity exercise are, brisk, you're warm, you're maybe not sweating profusely, you can still talk, but you're working. And then for vigorous intensity exercise, imagine like running for a bus that you really need to get. So you're hot, you're sweaty, you wouldn't be able to talk to somebody who's running alongside you very much. So that just kind of gives people a feel for how much exercise we want them to do. But actually for a lot of patients, adding in a brisk walk for 45 to 60 minutes, 4 times a week would have got them kind of over towards that target level.
And what are some of the biological mechanisms that are happening that are producing such a great result?
Well, so I suppose we don't necessarily know specifically why this works. But what we do know about physical activity and exercise is that it has a host of beneficial effects on the body. So regular exercise reduces inflammation. It enhances our body's immune response. It supports healthy digestion and healthy gut function. And that's particularly important, obviously, for bowel cancer. It helps with balancing hormones and maintaining a healthy weight. And all of those are really important physiological processes that could have an effect on cancer outcomes.
And did people know that it was good to do exercise while having cancer treatment before doing the trial? Or was that quite surprising for a lot of patients?
I think that was surprising for everyone, not just patients. So in Challenge, we recruited patients who had finished their surgery and chemotherapy. So they were kind of out of the kind of active treatment phase. But we know that that's a really difficult stage for our bowel cancer patients. We see them all the time in the clinic here. People, it's tough. It's tough having surgery and chemotherapy. And people's physical activity levels drop. They get deconditioned. And although they might recover in the time following chemotherapy, there's data out there that shows that they don't recover to their baseline or to levels near the public health recommendations. So we know that our bowel cancer survivors are some of our least active cancer survivors and also members of our population. So, I think there is a bit about when we introduce the concept of exercise, and also sometimes I think as healthcare professionals and as patients, everybody's busy, we're too busy to exercise, dealing with side effects of treatment, the mental burden of treatment, wanting to forget about cancer and get back to normal life. So there are lots of barriers to why people or patients might not want to exercise, but also for us as healthcare professionals, it's about, exercise is something that is, it's achievable by many people, not everybody. Some people will have other medical problems or reasons why they can't, but actually lots don't.
What kind of support was there for them? Was that in like a personal trainer?
So it was a tailored program, tailored for the individual, and it did have some required sessions. So we met with patients, the kind of bi-weekly behaviour support and supervised physical activity sessions were really about encouraging patients about motivation. And it was about sitting down with patients and saying, well, what were the barriers or facilitators to doing your physical activity targets for the week? What worked, what didn't? What do we need to change going ahead? What goals are we setting this week? So small graded goals, ultimately to get to this bigger target. And we know that this is what sustains behaviour change. And it's a change in mindset, for patients and for healthcare professionals and healthcare providers. It's about thinking, treatment is sometimes something you do rather than something you take.
Definitely. And it also kind of reframes the treatment process in a way to kind of have that focus on exercise, and sometimes feels like something you can control rather than the treatment that you kind of receive. You did this trial in bowel cancer patients. Would we see the same results for other types of cancer?
Yes, so potentially. So there is already, there's a wealth of kind of observational data in relation to other cancers, particularly potentially breast cancer. There's some nice data around physical activity and disease biology and prostate cancer as well. But actually there are a growing body of observational and population studies that suggest when we look at the most physically active versus the least physically active, are those meeting public health recommendations versus those who aren't. Following a diagnosis of different cancer types, that this could hold true for other cancers as well. So common cancers, breast, prostate, colorectal, esophageal adenocarcinomas, gynae cancers, other gastrointestinal cancers. So there is a wealth of data out there. There's some cancers we don't know, not necessarily because we don't know that it doesn't have an effect, but just because there isn't the evidence of the data out there. But this probably has broader applicability. And actually, when we look at the results of Challenge, when we look at the primary disease-free survival endpoint, the benefits of exercise were split roughly between secondary bowel cancer appearing, particularly in the liver, but also prevention of new cancers, particularly new colorectal cancers or bowel cancers, but also potentially breast and prostate cancers. And there's data yet still to come from Challenge. So obviously clinical effectiveness is one thing, but there has been data collected on cost effectiveness, which is obviously important for healthcare systems, on patient-reported outcomes and kind of quality of life. So the outcome measures that are important to patients as well as survival, and also samples stored to explore the biology. So that is yet to come.
Yeah, there are a lot of different avenues you could take in terms of what to research next, because it's like, is the type of exercise going to impact those results? Like resistance training versus, aerobic training, or, cancer location, those sorts of things. But this result is such a big first step. How does it start to change the way we start to approach treatment and incorporate exercise on a national scale?
So I think that is still a bit of a challenge. So we talked about mindset. So there's a bit about mindset of patients, clinicians, healthcare providers. So we did some work when we were kind of setting up and recruiting to Challenge around barriers to recruitment. And I think we learned a lot, and I think some of that will be relevant for implementation. So there's a bit about the messaging, about getting the message out to patients and to clinicians. So a bit about education. I think we're not always confident talking about exercise. And we do this. I mean, we do in other disease types. So for example, cardiac rehabilitation, pulmonary rehabilitation, we do have 12-week programs that are considered part and parcel of patients' treatment. And we have a growing number of rehabilitation services in cancer, and a lot of units have perhaps 12-week programs, but they're often maybe third sector or charity organised. They're not necessarily commissioned services. So there is a bit for those who commission healthcare services about how we implement interventions. Particularly Challenge was a slightly different intervention in terms of duration. So how we ensure that interventions that are tailored to particular disease types are implemented. So, we can do it, but I think it just requires a shift in what we consider treatment. For some patients, knowledge will be power. So I have patients in this very room for whom, they are increasing up their physical activity levels. They maybe have a background of being an exerciser before their treatment. So they kind of know, they're familiar with what they might do. And, so writing them a prescription and how to get there is something that for them, they probably will get there without much support. There are some people who will definitely need the support. For a lot, that could be community-based. And then there are some people for whom may need some specialist supervision in secondary care or hospital environments, rather than just simple community-based kind of maybe personal trainer. There's a level 4 cancer rehabilitation qualification that many community personal trainers have. So it's about thinking about where the expertise is and how we match that up with patients.
So actually, now you mentioned the cancer rehabilitation qualification, we actually had Cara on who's passed that qualification. And I mean, how important is it to have more people having those qualifications when it comes to supporting cancer patients when it comes to exercise?
I mean, it's really, really important that patients or people living with and beyond cancer are working with exercise professionals who are in a position to support them and their specific needs. And access to those type of trained professionals is also quite variable. And again, so locally, for example, we have a number of personal trainers, so people from a personal training background who were supported by the charity sector to get their level 4 cancer rehabilitation qualification. And then they support our patients in the community. But we don't necessarily know what provision of that service looks like across the UK and whether patients are aware that there is expertise perhaps close to home. So how they access these experts.
And do you think that these results have changed the perception for some clinicians when it comes to exercise and cancer?
I mean, there's always been some of us who have believed and we're always made recommendations, but I think it has brought on people who, maybe we're like, well, that's observational data, that's very good, but what does that actually mean for patients? So there's work ongoing around getting the, sort of communication or dissemination for patients, and also then for our healthcare professionals and for our exercise professionals.
What would be, I guess the first 5K to get us there?
So I think the easy win is the bit about mindset and awareness, about getting the message out, about the challenge results to patients, healthcare professionals, and the wider community. So I think that's an easy win. The next is thinking about the services that are offered locally in an area for patients and how those we might link in with what's already on offer and how those might be expanded or tweaked to meet the needs of this particular group of patients. And then there is, in the kind of bigger picture, looking at the cost effectiveness data as well that comes out from Challenge. So obviously we have a national model for looking at clinical and cost effectiveness for service commissioning.
And just to finish off, what's next for your research?
Well, you touched on it earlier. So I suppose, Challenge looked at patients who had finished their treatment. And sometimes one of the questions we get asked is, could it have worked even better if it had been started earlier? And there are small studies that suggest that exercise is really important during treatment. And so for me personally, we have a study ongoing looking at resistance training and kind of dietary protein. So an intervention that combines protein, calorie, dietary support and resistance training in our patients with advanced bowel cancer, because we know that muscle mass and body composition are really important. And there's observational data that show that loss of muscle mass is potentially adversely associated with cancer outcomes, tolerability of cancer treatment, and physical function in patients with cancer during and after treatment. So we want to look and see, can we prevent loss of muscle mass that might be induced by chemotherapy? And does that make chemotherapy more tolerable? Are patients more likely to complete treatment? And are their cancer outcomes better? So we're in the early steps of testing that question with a view then to doing a larger trial that might position or prove effectiveness in the style of Challenge.
Amazing, Vicky. Thank you so much for coming onto the podcast. I mean, your research sounds incredible. I can't wait to see the results you come through with.
Thank you very much for inviting me. It's been an absolute pleasure to come here and talk about something that's really, really important, and getting the message out that there is something that patients can do beyond their usual treatment. It's just really, really important for all of us.
Thank you, Vicky.
Thank you.
Thanks for watching this episode of That Cancer Conversation. If you're enjoying the show, you can give us a like and don't forget to subscribe to our channel. All of this episode's resources are in the description box below. And for more cancer stories, you can visit our website, Cancer News. Also, if you have a question you'd like to ask us, you can comment below or email podcast@cancer.org.uk.